strategies that you can use that may protect your brain as you age. Next slide. So first we're going to talk about brain health, and many people, just automatically think brain, memory, talking, etc. But the brain manages many functions: cognitive, motor, emotional, tactile, and sensory. And in the next few slides, I'll explain a little more about those. The next slide. So cognitive health involves thinking and learning and remembering, the things that a lot of people associate the most with the brain. But it also controls motor function, how we make and control our movements, even including and especially include for older people, balance. Emotion is also an important thing that the brain manages. It interprets and responds to emotions, both pleasant and unpleasant. Next slide. Tactile refers to how the brain manages our response to touch, pain, and temperature, and would be, for example, why a certain emotional state might cause pain when touched in a certain area, while another one might not, because these all interact with each other. And finally, sensory, which involves seeing, hearing, tasting, and detecting odors. Next slide. So now we're going to talk a bit about the changes that happen in people's brains as they age, particularly over age 50 or so. We're going to talk now a little about the cognitive changes, the structural changes, the neuron or brain cell changes, and chemical changes. Next slide. So first, we're going to talk a bit about the cognitive changes that occur as the brain ages. People tend to have less cognitive ability, especially to memory. And as we'll talk in a bit, this can still be part of normal, common aging. Also, some things that they were able to perform, physical abilities, often at the same time tend to remain intact, especially ones that are well practiced, for example, cooking skills, or for a while at least driving skills. However, there is a decrease in what's called, in a couple kinds of memories, something called working memory and something called declarative memory. Working memory refers to the few seconds, such as trying to remember a phone number to go ahead and dial it. And it also interferes with problem solving, especially if you can't remember the number for a few minutes to make the call. It makes it very difficult for the person to make the call. There's also a decrease in what's called declarative memory, specific learned facts like where you grew up, what color your house was, who the president of the United States was. And those often decline some as people age. There's also difficulty, diminished attention and focus, and people tend to have difficulty dividing attention between tasks, such as doing some light housework while they're cleaning, which they've been able to do when they were before they were aging. The next slide. And so in normal aging, these changes tend to be subtle or sort of maybe mildly noticeable. The classic person going into a room to get something and they can't remember what they were going in to get to. However, in neurodegenerative diseases and dementia such as Alzheimer's disease, these changes tend to be more subtle. Changes are much more severe, and say in the subtle to severe range. Next slide. We'll talk about the structure. As the brain ages, as people age, there's changes in structure There's decrease in brain volume, especially areas that affect memory and complex tasks and balance. That's why people with early dementia, such as Alzheimer's, often have memory problems, difficulty driving or paying their bills, and also starting to get some balance and fall problems. The neuronal changes of the brain cells, as people age, they basically thin and shrink. And these brain cells typically have a lot of branches that connect to other cells, and that's they communicate so very complexly. However, as people age, to some extent, these cells tend to just kind of shrivel up. There's also what's called, the chemicals changes, less production of the important messenger changes chemicals in the brain, like dopamine and serotonin. Next slide. And a few other issues with the aging brain. The brain, blood flow to the brain decreases. Inflammation, which is the body's response to injury or disease, may increase. And these changes affect both mind and physical function. So it's very important to realize that the brain doesn't just manage thinking and cognition and judgment. It also manages physical function, and they interact throughout the course as people age. Next slide. So I'm going to mention the three potential trajectories people take as they're pushing over 55 to 60 or so. You can basically put them into three groups. Group one is normal aging over the course of life. Group two is progressing over time to more severe symptoms, such as a dementia, such as Alzheimer's disease. And third, and of particular interest of modern research, is a transition state called mild neurocognitive impairment, also called mild cognitive impairment, or MCI. So this is kind of a transition state where it's more than normal aging, but it's not enough to be a dementia such as Alzheimer's disease. And it is the pathway for many people to develop Alzheimer's disease. And year by year, people who have mild cognitive impairment are at increased risk of potentially developing in more severity and dementia. However, that is not always the case. It's not always that it's a harbinger of something worse coming on. Some people, it may stay stable or just maybe mildly worsen over time. Some people may even have some improvement. So a lot of interest in research today is how to get people who might be at risk for impairment and stop the impairment from progressing. Next slide. And the next question is, are these various risks of dementia modifiable? And one very important finding that came out back in 2024, well, a repeat of one that came out a year prior or so, is that if 14 presented risk factors modifying factors could be instituted, this may prevent up to 45% of cases of dementia across the world. So being able to be familiar, and we'll talk about this in the next slide too, familiar with potential risk factors for dementia and ways to address them, that could be a very, very major game player for treating Alzheimer's and other dementias. Next slide. So now we're going to go over those 14 things that can put people at risk for progression to dementia, such as Alzheimer's disease. First, in early life, there's only one item on that list, and that item is low education. The next slide. And this is where, however, interestingly, most of the potential risk factor intervention happens towards the middle of life, not early in the age, and not as much as people age. So in midlife, the things that might address might be able to change and slow down progression in dementia include addressing the following: hearing loss, high what's called the LDL cholesterol, depression, physical inactivity, traumatic brain injury, smoking, high blood pressure, obesity, excessive alcohol, and diabetes mellitus. Next slide. And then late life, there's a focus on addressing things like social isolation, air pollution, and visual loss. Next slide. So much of the rest of the talk is going to be talking about a group of potential interventions that can help keep your brain healthy as you age, and I'll go through each one by one. But to introduce them, they are: first, physical activity and exercise; nutrition; cardiovascular risk factors; cognitive stimulation; avoiding tobacco and heavy alcohol; social engagement; taking care of mental health; and addressing hearing and vision issues. So next slide. And also the final two, managing chronic medical conditions and addressing sleep. So next slide. So first, we're going to talk about physical exercise and activity. Many studies have shown an association between aerobic exercise and the lower risk of dementia, with aerobic being things that are repetitive actions that are moderate to strong intensity, that help get more blood to your brain and help get more oxygen into your body. And this exercise has been associated also with the increased volume of a part of the brain called the hippocampus, which is crucial for memory. And the mechanism may be improvement of vascular function or addressing as I talked about, the neuroinflammation. Despite, we always talk appropriately about getting exercise, the studies to date themselves have been rather sort of mixed, some finding benefit, some finding maybe a little or not much benefit. A more recent study showed that both aerobic exercise may be helpful, but also even stretching, bending, and resistance. And aerobic exercise, common things might be running, bicycle riding, or even brisk walking. Next slide. Okay, so, and a recent study by the Harvard Aging and Brain Study looked at 300 adults over 10 years, and they counted steps with one of those pedometer things, and found that there was that this walking itself can give significant protection in cognition. Another study is also similarly showed benefit both from aerobic and resistance training. The general amount of steps typically proposed to be effective is 3,500 to 7,500 daily. Slide. And the next, we're going to talk about nutrition, and nutrition likely can play a very significant role in increasing or decreasing the risk of cognitive decline with aging. The one that you've probably heard the most of is called the Mediterranean diet, and it's inspired by Greek, Italian, and Spanish diets. It focuses on reducing saturated fats, and especially, and this is strongly typically recommended, although I have to say I'm super guilty of breaking, eating minimally processed foods, minimizing red meat, and including a lot of fish and seafood, poultry, fruits, beans, grains, olive oil, and avocado. And one study suggested that adherence to this diet might reduce the dementia risk to as low by about 23%. Next slide. There's another similar diet called the MIND diet, which is it stands for something that's way too complex for me to remember what the actual words are. But it's a combination of the Mediterranean diet and something called the DASH diet, which is often used for hypertension and cardiac issues. The diet, it's a fairly similar diet. It emphasizes natural plant-based foods, limiting saturated fats and animal foods, and a lot of berries, green leaves, vegetables rich in vitamins and antioxidants. And there is some research evidence suggesting that there can be some decreased risk. Sort of an iconic MIND's diet kind of thing might be something like salmon with spinach and blueberries. And if you log on to Google and Google blueberries, salmon, and spinach, you'll get like a whole list of recipes that you could potentially use. Although I can't vouch for them, so I can't say whether the recipe itself is safe or not. But using the type of food, those foods can be helpful in decreasing risk. Next slide. So the missing link in terms of how to understand the challenges and understanding how much and exactly how diet can help. There's still the question about do these diets provide the actual sufficient number of nutrients to effectively reduce inflammation and things like oxidative stress, in which particles in the brain go and savagely kill all the neuron cells and DNA and all sorts of stuff that leads to impairment. Next slide. Next is cardiovascular. Midlife, and as we talked about, midlife vascular factors are often associated with late life cognitive impairment. So it might actually be in midlife when it has the most benefit. And that's addressing things like obesity, blood pressure, lipids, and diabetes. Next slide. And there's been a recent study that looked at aggressively controlling blood pressure to no more than 120/80, showed an increase in it, showed decrease of general cognitive impairment, and at least a trend, not quite significant enough, of decreased incidence in dementia. However, there's also been some studies that look at tight blood control that don't show the benefit. So like a lot of these topics, there's not a lot of solid, major, large research studies. So you got to go by your best judgment. And most of this stuff is good for you, even if it doesn't make a difference. Next slide. Something called brain training, which is giving people various cognitively stimulating activities, may have some benefit in people with mild or moderate dementia, helping improve thinking, concentration, memory, communication, things like storytelling, memory, group sessions where people talk about memories from the past and focus on various tasks and skills. There's there's a lot of these brain stimulation programs. It's not quite clear exactly which ones might be more or less effective at this point. So it's hard to give a strong recommendation yet. Next slide. A recent study looked at cognitive impairment in patients with, showed that it might improve both cognitive impairment and help with depression symptoms as well. Although again, like I say, many of these this was a study like looking at multiple other studies and analyzing them together. And although it showed some benefit, but it's still, kind of scarce amount of data and more research needed. Next slide. So other things that are just probably, although again, there's not like specific data on, but things that might keep you active: reading, puzzles, learning how to play piano, learning a new language, taking improv, taking a course at college, especially if you do it socially in person. But the important thing is it's a skill that's new to you, complex to learn, and can be continued over extended duration, and emphasis on complex to learn, not one of those little bang the bats or whatever things on people's iPhones, which I never actually watched before. New slide. Now we'll talk about tobacco. It's been released in linked to cognitive decline with oxidative stress, inflammation, and cardiac disease. And research studies that even middle-aged or older people may have decreased risk of cognitive decline if they stop smoking. Next slide. And alcohol is sort of, can work in sort of a double whammy way. Number one, it's directly toxic to brain and can cause brain damage. It also increases the risk of traumatic brain injury, which in itself has been found to be a risk for developing dementia later. And particularly heavy drinking, like more than 3 drinks a day, appears to significantly increase the risk of dementia. A recent study showed that, showed that possibly light drinking might increase risk, while light drinking might decrease risk a little, but heavy drinking largely increases the risk. But I wouldn't. There's also some concerns in general about even light drinking these days. So I would take that, sort of judiciously and talk with your doctor. Next slide. Social engagement, in particular, loneliness and lack of engagement is associated with decline. Socialization involves using our skills that we want to work on, like language, memory, attention. A study of about almost 200 people, 75 and older, they had like a trained researcher call, I think, once or twice a week and have a cognitively stimulating interview with the participants, and it appears that these weekly calls seem to be associated with less risk of cognitive decline when looked at in the future. Next slide. So in terms of taking care of mental health, many epidemiologically there's a lot of concern that treating mental health, particularly depression, can have an important role in decreasing cognitive decline, especially if you have any cognitive decline, such as major depressive disorder, bipolar disorder. The person's functioning is, in many areas, is likely decreased, including areas that could help prevent dementia. And many epidemiologic studies show that late life, specifically dementia, late life depression increases risk of dementia. But still, there's never been any kind of prevention trial. I'm going to give a brief, slight side turn in terms of, we're talking about risk factors over time, but there's an acute and dangerous one called hospital delirium. And if I could see the next slide, please. So hospital delirium is sometimes called hospital confusion. Essentially, patients who are seriously ill can get acutely confused with memory problems, attention problems, not able to focus, visually hallucinating. It's typically caused by one medical problem or a combination of medical problems. It's very, people say, it's important to not think, oh, well, they just getting like that, they just had a major surgery, because it's, it can be associated with significant length of stay and mortality risks. And a lot of times that the medical team might not have picked it up. So it's important for people, who have loved ones in the hospital, if they suddenly start getting confused, that, the medical team be aware and address it. And also when people have delirium in the hospital, improvement sometimes takes over weeks to months. And it can be really something that can decrease someone's quality of life long term. Next slide. Managing chronic medical conditions, and we already talked a lot about this, but especially these chronic conditions like high blood pressure, diabetes, lipids, atrial fibrillation, sleep apnea, which involves decrease in oxygen supply to the brain, and also many medicines that can cause confusion in the elderly. Some of the biggest offenders are benzodiazepines such as lorazepam and clonazepam that are often given for anxiety and sleep, and opioid medications. Next slide. Now, treating and hearing loss can be of benefit in dementia, in helping minimize dementia and cognitive impairment. One thing that it could potentially do is reduce the cognitive load, the work that the brain has to do in processing sounds. And yet when they have to work, has to work harder, it's, putting more stress on the brain. Treating hearing loss also can increase brain stimulation in general, and also, improving social engagement, so people aren't going like what during their social interactions. And next is treating visual loss can have similar benefits, and an analysis of prior studies showed that visual impairment does appear to be associated with both cognitive impairment in general and dementia. Next slide. And finally, addressing sleep. Now, sleep has an interesting what's called bidirectional relationship back and forth between sleep and particularly mild cognitive impairment. One of the benefits, although still no one knows the full answer about why people sleep at night, one thing that appears to happen is that during sleep, the body clears substances such as the certain proteins like amyloid, which is linked to Alzheimer's and associated to other forms of cognitive impairment. At the same time, the brain damage itself from a cognitive disorder such as Alzheimer's can in itself interfere with the sleep cycle. Obstructive sleep apnea, as I talked about, can lead to cognitive decline and can be treatable with with the CPAPs or other devices. And when treating sleep, it's always best to work, especially when working together with your doctor or other care providers, that you try, if possible, non-pharmacologic treatments like sleep hygiene, going to bed at a certain time during the day, not having the television on, things like that, over sleeping pills when possible, given the potential for side effects. On one hand, they're sleeping over the night, but they're more sedated, unsteady, and confused. Next slide. So as we're ending, just a couple other more chronic risk factors to mention that haven't made that list yet, but poverty across the age range appears to be associated with increased risk of cognitive impairment, and also people with lower socioeconomic situation might have less healthy food, for example. HIV is a risk factor for cognitive impairment and can also cause a dementia as well. And there's something that I've actually never heard of this word before, but called wealth shock, in which losing 70% of people's total wealth can distress the person and cause impairment to their brains. And it goes along with how financial downturns in general could trigger multiple health-related issues, including ones that could affect cognition. Next slide. So for the last few slides, I'm going to go through a set of things that you can do for brain health that may help, and even if it doesn't help, it's probably good for you. First, remember physical activity and exercise. And the amount is often suggested is 150 minutes a week of aerobic exercise. Nutrition, consider if you're not going over it completely, even just consider incorporating some elements of the Mediterranean or Mind diet with your meals. And cardiovascular, maximize control of blood pressure and lipid levels, manage diabetes, and stop smoking. Next slide. And further on, for screen, remember cognitive stimulation, learn a new complex skill. Tobacco and alcohol, stop smoking. And if you do drink, do so in moderation and with contact with your doctor. social engagement, look for activities to engage with others, and mental health, address mental health issues, discussing symptoms like depression or anxiety with your primary health provider. Next slide. For hearing and vision, working with your medical provider to maximize your hearing and sight, managing chronic medical conditions such as high blood pressure and diabetes and sleep apnea. And finally, trying to get at least 7 or 8 hours of sleep and use non-pharmacological treatments for insomnia while possible. And the next slide. And that's just to acknowledge Paul Rosenberg, who I got some material from for this talk. It's the end.
Well, thank you, Dr. Steinberg, for that very informative presentation. We're now going to open the question and answer portion of the program. I'll start off with our first question. An older relative in their late 60s who has a history of depression has recently had increasing difficulty initiating tasks like housework. Is this normal aging, or might it raise concerns about early dementia?
And so you said, I'm sorry, it's coming in a little shaky, that a lot of they're having difficulty with tasks?
Right. Increasing difficulty initiating tasks like housework. Is this normal aging, or might it raise concerns about early dementia?
I think, yeah, go ahead. Sorry, I didn't realize.
I realize you cannot diagnose anyone based on this brief comment. Just interested in how concerned she and the family should be. Thank you.
Right. So I'd say it depends on the specifics of what they're having trouble with and the severity and to what extent it's a change for them. So, for example, a person who still lives independently and they do all their own cooking, and one day they're planning a party or something like that. One day they forgot to turn off the stove, and then they go, "Oh my God, I left the stove for 8 hours." Patient number 2, who was always known for their cooking skills and dinner parties and all of a sudden is regularly making recipes wrong, turning on the stove, forgetting the stove on a regular basis, forgetting familiar recipes. So it can be it's a matter of this degree that they use the word, again, it's a judgment call of the clinician that's evaluating it. Significant decline from someone's baseline. For example, someone who never cooked at all suddenly has to cook for 10 people and can't do it. That's not necessarily something that would be pathologic. And also, you're typically not taking one issue like difficulty with checkbook in its entirety when you're trying to determine whether someone has mild cognitive impairment versus dementia. Oftentimes, a lot of getting the full information of what they're doing in their daily life, and sometimes it can be very difficult. And that's often somewhere where a specialized memory care center could potentially do a full comprehensive evaluation to see if on neuropsychological testing to see if someone's testing is consistent with mild cognitive impairment or an early dementia.
So next we have is not a question, it's actually a statement, but I'm interested to hear your perspective on it, Dr. Steinberg. This comes from David. According to the Physicians Committee for Responsible Medicine based in DC, it is extremely important to not eat meat for brain health. There's research to support eating a whole food, plant-based diet.
I think that is an important point. As I said, a lot of these things are not, these are things that there's a lot of hope for, but there's not a lot of good studies, or especially large placebo-controlled studies that things can be recommended with high confidence. But at the same time, these things may have some benefit, and for most people, they help more than harm. But yeah, I mean, it's things are limited. Probably some things like they could say a little more your confidence with things like controlling controlling health problems, while some things like the Mediterranean diet and the and exercise, where there's a little, there's less, there's a lot of conflict. And in particular, especially when you're talking about things like over-the-counter supplements and things like that, there, whatever research is done for those are either non-existent research or things that just don't, that are all over the table. And partly, because one of the vulnerabilities too is that with the issue of cognitive impairment being so concerning for people, it really opens a gate for people to kind of take advantage and present some sort of miracle cure that turns them into a new person.
Our next question, do exercise and healthy diet help minimize or delay development of cognitive issues and dementia? Or can they actually reverse existing cognitive deficits in some people?
Yeah, I don't think that they're, especially for the reversing. To my knowledge, I don't know that there's actual research study given to that. But so I don't know if we know a lot about that answer, because even there's still some question to what extent the diets help in the first place.
Okay, again, another statement versus a question. I'm still fuzzy on the matter of determining whether mild memory problems with aging is a sign of more serious cognitive decline or something to not worry about. There needs to be a clear way of determining this.
Yeah, and right now, again, it's an area right now of very hot research. The fact, the concept that there's over the past several years, it's been a lot of growing interest that this concept of this transitional state between normal aging and potential things such as a dementia. There's a lot of interest in how do we know who is at risk, who's going to get dementia, who's going to live their life with mild problems without with that aren't that problematic, who's going to live, who's going to have problems, but mild problems, but able to manage them. And that's a lot of unknown and a lot of area where a lot of the probably I'd say that one of the biggest areas is question of what happens to people, because there are these three trajectories going towards something more serious, such as Alzheimer's disease, staying relatively stable over time, or sometimes even improving a little bit. We don't know yet who, how and who exactly has that trajectory.
Another question regarding brain training. Any thoughts about the value of learning a new language or other academic subject or a musical instrument?
And these are things that, again, they're not really been officially studied at this point. But given the nature of how doing complex, enjoyable tasks can lead to health, including some evidence for cardiovascular health, it's something that might be beneficial, although we don't have the kind of research per se to back it up. But in particular, the just from what's known as about the brain, that engaging in complex and sustained activities may be associated with changes of the brain that might protect or delay cognitive decline.
Donna has a question. Have any nootropics such as NAC or magnesium L-threonate demonstrated a clear benefit to maintaining or improving cognitive health?
And I'm sorry, some of it didn't come in clear. I'm sorry.
Okay. Have any nootropics such as NAC NAC, or magnesium L-threonate demonstrated a clear benefit to maintaining or improving cognitive health?
Yeah. Although I'm not specifically familiar with that specific one, I could say just, and in touch with, in communication with my colleagues over time, other than the things that we talked about, right now, there's really no clear over the countery or substance. I'll take this back in 1 second, but there's nothing really clearly to confidently recommend. But the one exception would be the multivitamins might have some benefit. And in that, I understand from Paul Rosenberg, my colleague who works in the memory clinic there, they often suggest multivitamin, but they typically don't suggest to people they don't specifically check to people things like supplements unless needed. For example, like if they have low B12, certainly they should get a low B12 supplement. Although best of all would be for someone to eat foods which have the nutrients so that they don't have to go to the supplements, because we don't know about any of them, whether they work and or what dose would be appropriate to work or not work.
Would you recommend for someone age 70 who has been taking, I think it's donazepam for a number of, I'm sorry, go ahead.
What-a-pam?
It's DONAZEPAM. DONAZE.
Donazepam. Okay, what sometimes called brand name Aricept, which can potentially have some mild benefit in slowing down the course of Alzheimer's.
Right.
Yeah.
The question is, would you recommend that someone age 70 try to taper off this medication? The person in question feels like he's addicted to it.
So they're worried that the person might be addicted to donepezil, and at age 70, should they come off of it?
Yeah, the person themselves, the person that's taking the medication, is afraid that they may be addicted to it.
Oh, it's not addictive.
Okay. So in other words, you say it's safe. You don't recommend that the patient, that this person needs to taper off or come off of it, correct?
Well, of course, it depends on there's nothing specifically reason that they should stop, but you have the whole question about whether they should actually stop it. You'd have to actually know the full patient, examine the patient, know their other medicines and other things.
Okay, our next question comes from Rachel. When a person starts to show signs of MCI, are there treatments other than brain training and learning new activities that might help slow it down? Are there any medications that might help? Are there any medications that you recommend?
So and I'm sorry, you said they have some mild cognitive issues?
Yes, correct.
Yeah. So certainly there are medicines that are typically used in more severe cognitive impairment. So you probably wouldn't use donepezil. And the general talk about that is that it's not a clear medical treatment to potentially, which has some sort of FDA approval or extensive study about preventing mild cognitive impairment to going to dementia. That's why a lot of the research and the excitement for people in the field is based on that exact issue. We don't know what happens.
Our next question comes from Suzanne. For those with acquired brain injury, how does damage to the myelin affect the brain and risk of cognitive impairment? Does neuroplasticity help with that?
Yeah, I don't know that I have the expertise to say the exact things that are associated with head injury that ultimately cause the dementia, but there's been concern about the link for them, especially in certain people who are very genetically predisposed to Alzheimer's disease and have a head injury. So so just one thing is trying to avoid severe injury to the head. And there's a lot of ways that people can have injury over the when they have a head injury. And one thing to think about too is that head injuries are probably pretty much different. So one person's head injury from falling down while drunk is different from one kid's injury who got a soccer ball in soccer class hit at their head.
Okay, Dr. Steinberg, I'm going to send a term in the chat. I just sent it to everyone. So look at the latest chat because I don't want to butcher this term. But the question comes from Nancy. She said, what did you say about this term that I just put in the chat? And what kind of inflammation were you talking about?
Wait. I'm sorry,
It's a
could you
term that
repeat it
starts
one
with
more
a
time?
B. Benzo, I can't pronounce it. I just put it in the chat. Do you see it? The term?
Let me see. I'm trying to look where the chat
I'll spell it for you.
Okay, I found the chat. Let me see if I
Okay,
can.
look at the very last message.
Okay, so at 152, the last message says the word benzodiazepines. Then
Yes.
says how much of dementia can be driven by one's genetics. Is that?
No.
I think
So I'm just having you look at the term. The question comes from Nancy. It's not in the chat. It's in the Q&A. The question is, what did you say about this particular term, and what kind of inflammation were you talking about?
yeah. Just there can be, as people's brains age, there can be inflammatory kind of change. It's a complex issue of brain chemistry, but could be a sense that there could be just sort of your brain inflammation that could potentially contribute to problems later on.
How can you tell the difference between dementia and side effects from perimenopause?
Perimenopause, typically dementia, the most common form of dementia is Alzheimer's disease. It most commonly occurs after age 65 and possibly around, and sometimes age 60 or even slightly younger. And it also increases with age, dramatically with age too as well.
Could you talk more about balance issues? Can issues
about what?
Balance issues.
Yeah, balance issues. Yeah, and as I think that relates to the issue of the brain, the relationship between the brain and the body. The brain doesn't just manage things like memory and language. It does manage, your body, your body and your body's movement. And especially, for example, there's a part of the brain called the cerebellum that's important for balance. And if that's damaged, people can become more unbalanced. And also just the brain structures in your brain that help make you walk steadily and smoothly can be damaged from the damage from the dementia. So having a dementia is not just having some forgetfulness. They also have changes in their ability to balance, walk, stiffness of their arms, multiple things.
Is there a genetic test available for Alzheimer's disease?
There are tests that can diagnose it that can highly suggest it at an early age. To my knowledge, unless things have changed fairly recently, it's generally not recommended to get the testing, because one issue, it's not 100% testing. So there could be, you could get the test positive and be absolutely devastated, but you don't really have it, or vice versa. I don't think that I think that there's talk about being very close, or possibly even having something that might be able to tell that they have dementia. But I think there's also a lot of concern about the potential implications.
As a follow-on question, Thea asks, what do you know about the new infusion approved by FDA that supposedly stops early onset of the progress of Alzheimer's?
I'm sorry, the what did you say at the beginning?
What do you know about the new infusion approved by the FDA that supposedly stops early onset of the progress of Alzheimer's?
Okay, yeah. So that's an area too in terms of dementia care, the infusions. I think one thing to be aware of with the infusions is they don't cure or halt the progression per se. However, people who get the infusions typically, commonly have a slow, depending on the medicine or the study, like something like a 30 to 40% slower decline than people who don't get the infusions. But the infusions also have some potentially serious side effects as well. So you have to take everything into consideration. But unfortunately, unfortunately, and again, that's an important point, just similar to a lot of the treatments for Alzheimer's disease, there's no sort of way to stop or halt the process. There's a lot of the medications and infusions and all can help slow down the process. And even if it could slow it down by 6 months or something, that's 6 months of extra life, living at a higher level of function.
Okay, so we have time for one more question, possibly two. We have 2 minutes. And these two questions are from Dave and David. Dave asks, but they're related. Dave asks, how much of dementia can be driven by one's genetics? And David asks, is Alzheimer's hereditary?
Yeah, Alzheimer's is partially hereditary. With a large number of people, particularly having what's called a certain genetic finding called apoprotein E4. So there are various genes that increase the risk of getting Alzheimer's disease, but they're not 100%. But people don't 100% develop Alzheimer's disease after it. It's more of a risk factor. And I don't know exactly if there is a number for like what percent of genetics goes into it. And I think it also depends a lot on the individuals and their own life trajectory to what things might have happened over the course of their life, like a head injury and not just vegging at home and watching TV all day, which I'm unfortunately guilty of, but that there could be different people. It could be a different answer.
Okay, and the very last one, Cheryl asks, is the information I learned today okay for me to share with my protective services investigator handling my 91-year-old mother's case? She insists on living alone and cannot do 85% of what was stated in this presentation.
I think the only thing I would suggest if you share the materials with her, just realize that we're discussing potential things that might be helpful. We're not specifically giving exact answers like this is helpful and you should do that. The main thing, but these are things that may have benefit and things that to think about. And it's also always best, particularly if you're going to be doing something like starting an exercise project or something, be sure and talk about it with your doctor first, because by definition we can tell you what the things that are being looked at are, what the research has showed so far, but we don't have even if we couldn't give the information, specifically recommend someone do something or not do something.
Okay, thank you, Dr.
But it can be helpful to talk with your doctor.
Okay, thank you, Dr. Steinberg. Unfortunately, we were not able to get through all of the questions today. And ladies and gentlemen, this concludes today's webinar. On behalf of the Community Health and Wellness team at Suburban Hospital, we sincerely thank you for joining us and extend our deepest gratitude to Dr. Steinberg for sharing his expertise today. We hope this discussion helps you make more informed choices regarding your health. As a reminder, please take a few moments to complete the survey that will appear at the end of the webinar. Your feedback is greatly appreciated and helps us improve future programs. Thank you again and have a wonderful rest of your afternoon.